Hi, this is Dr. Eric Donor at the New York Skin and Vein Center, and today I'm going to be demonstrating enhancing cheekbones or restoring cheekbones. Okay, so as we start to age, we start to lose fat and collagen, and the skin and the muscles get thinner. Plus, there's some gravity, and it's much more apparent in the cheeks. So, in this young lady, you can see she has some loss of volume here and descent, and her eyes are pretty good, but she's getting a little flat. And in the past, she used to have very high cheekbones, lifted her cheeks, gave her a nice feminine look, and we have the same thing happening here on the right side. So what we're going to be doing today is Radius, which is a favorite of mine for the cheeks. And what we're going to be doing is putting a drop of Novocaine and using a long tube to help fill in this area to enhance them and restore them. Okay, so Radius looks like toothpaste. It's calcium hydroxyapatite. It's been around for at least 10 years, and it's a very nice volumizing filler. It gives you volume, it gives you a lot of heft, so it's great for cheeks. And in fact, that's the only place that I use it because it is stiff, so that's also good for cheeks. Okay, usually one syringe of Radius will get you by for both sides. And then you live with it for several weeks and see if you need more. So I'm going to get her ready and show you how we do this.